So we have this question, is all pain bad? And the answer is no. And we'll say meet Harriet. So if you see this picture on your screen, this is a dissection of a human nervous system. It's been called Harriet, and the 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 background of this actual dissection is a little mysterious, to say the least. But it is a actual human dissection of our nervous system. And see, what is pain? Pain is a message from our great protector, which is our nervous system. In fact, uh, there are a few people on earth who are born with the inability to feel pain. Uh, but they're few and far between. Why? Because they often die in childhood. See, we need pain. Pain alerts us to potential dangers. And so for those people who are born without that ability to feel pain, they might get an infection and not even know it. So we need pain. Some experts have said that pain is your body's way of asking for a change, or pain is a way that your body is asking for more information. So it's the handiwork of our nervous system. And so let's just briefly identify our nervous system. There's different parts. And so the central nervous system is our brain and our spinal cord. Think of it as at the center of our body, if you will. That's our central nervous system. The peripheral nervous system is all the nerves coming off of the spinal cord. And there's about 400 nerves that come off the spinal cord. And if you were to link them all together, it's almost 45 miles long. What a tremendously complicated system this is. But you can think of it as like a living organism within us, like a radar system. And it's all connected. As you can see from the picture, there's a unity there. And really to see how some of this connection can be felt, in the orthopedic world, we do something called a slump test. So if you're not in too much pain, hopefully you're not in any pain, but don't hurt yourself. But the slump test basically has a person slouch in their chair and then gently lift one of your legs up with your toes pointing up. And if you were to do that, you're slouched over, you're gently lifting one leg up with your toes straight, knees straight, you'll find a tension building up probably in the back of your thigh, maybe even into your back, perhaps even into your neck. Now, notice the tension change if you were to move your neck back and forth, up and down. So be gentle if you're going to try this. But what's the point? Our nervous system, all that tension you're feeling is within our nervous system, and it's connected from head to toe. So all pain, is it bad? No. But is uncontrolled pain bad? Absolutely. And if you've had chronic pain, you know that it affects you in many ways. And what we've seen proven is that it slows down brain processing, as we'll discuss in our next slide. But basically, parts of our brain that are busy with normal everyday functioning have to divert some of their power and energy to make pain. So what is the consequences? We have slowed down decision making, more cognitive errors. We're actually affecting our immune system when we're in chronic pain. And basically, our nervous system, our immune system, and our hormone system, which is called the endocrine system, those three systems really make up one big super system. And one of those systems cannot act without input and activation of the other two. So our immune activity is modified, reproductive system is affected too. So think about it for yourself. How do you feel when you have pain or your chronic pain is flaring up? Are you able to concentrate? Might you be a little more irritable? Uncontrolled pain is a problem. And so what we want to do is try to prevent pain from becoming uncontrolled, trying to prevent chronic pain in the first place. Easier said than done, but so often it's been found that chronic pain started after an acute or a fresh injury. So when we have a fresh injury, we have to attend to it right away, control that pain, understand what's happening to avoid it from becoming chronic.